Hello everyone, welcome back to my channel. So today we are going to start a new topic, that is respiratory pharmacology. And in this lecture we are going to study about the asthma and cough. Like in this lecture, cough is divided into dry or productive. We are saying dry because no sputum production takes place. And we are saying productive because sputum production takes place. And in the productive cough, basically, we try to expel the sputum. So we will focus on the treatment which will expurgate the sputum out of the body. Dry cough can be more worse than productive cough. So in asthma, it is a chronic inflammation disorder of the airways which will activate the mast cell. Like mechanism of action includes, like a person is allergic to something like food, dust, mite or pollens. So person is contacting with that allergen which will activate the IgE and which will activate the mast cell, and later on degranulation takes place, which will release the inflammatory mediators like histamine, serotonin, leukotrienes, prostaglandins, and eosinophils, and lead to the bronchoconstriction, which leads to the increased production of mucus, which is also called as acute attack of asthma. The symptoms include coughing, wheezing, and problems in breathing. And in the later stages, leukotrienes basically recruits inflammatory cells and will lead to the inflammation. So, in the asthma, basically two things are taking place: bronchoconstriction and inflammation. So, the treatment, the pharmacological treatment, will lead to the anti-inflammatory drugs and the bronchodilator drugs. So, the treatment includes bronchodilators, anti-inflammatory drugs, plus oxygen support to the patient if person has problem in the breathing. So, bronchodilators includes beta-2 agonist, also called as sympathomimetics, methylxanthines, and antimuscarinic agents like it will focus on the anticholinergic effect of the receptors. So beta-2 agonists will bronchodilate, methylxanthines like theophylline, which blocks the PDE, which is phosphodiesterase, and which leads to the increased production of CAMP, and smooth muscle relaxation takes place, which later on dilate the vessels. Antimuscarinic bronchodilation. So anti-inflammatory drugs roles around the corticosteroids, mast cell stabilizers, and leukotrienes antagonists. Corticosteroids can be given as inhalation or systematic. Systematic in severe cases. Mast cell stabilizers can only be given prophylactically, which basically means if a person is facing the attack, it cannot be benefited. But if a patient is not having any attack, it can only be given before the attack. Leukotrienes antagonists, which will either block the leucosynthesis or block the receptors, can be LOX or can be COX. We have a new approach like anti-IgE monoclonal antibody, which will mask the IgE and which blocks the IgE production or which will block the activation. So these are the drugs. We are going to study more about the drugs in later videos, like the mechanisms of action, sympathomimetics, mast cell stabilizers, leukotriene antagonists, antimuscarinic agents, and corticosteroids. So thank you.